And welcome back. Alzheimer is usually taken lightly as well as a sign of aging, but it's definitely more serious than you think. Yeah, to help us understand, to get a closer look on disease, we have Dr. Ria Maria Theresa in the studio. Good morning, Dr. Ria. How are you this morning?
Good morning. I'm fine.
Yes, this morning we'll talk about Alzheimer. What is Alzheimer?
Yeah, Alzheimer is part of dementia.
Okay.
Yeah, dementia, it means decline of cognitive function in people. It means you cannot remember.
Okay.
You can do something you usually do every day.
Right.
Or
you just don't realize what you do sometimes.
Yeah, you don't realize it. And maybe you cannot do everything you do usually every day. Yeah.
What are the cause of having an Alzheimer?
And many causes.
Is it aging or?
Yeah, aging is part of the cause of Alzheimer.
Okay.
But many causes of Alzheimer, especially dementia, depression. Yeah, post-power syndrome make depression.
Okay.
Yeah, diabetes.
Diabetes.
Yeah.
Oh, that's involved also.
Yeah, hypertension.
Okay. There's an example also. For example, my dad. For example, he keeps repeating himself whenever he talks every 10 minutes. Is that a sign or?
Yeah. If people ask every 5 or 10 minutes for the same question, you must maybe you must do something for him.
Okay.
Bring him to the doctor to know, is it part of this is the normal part of aging, or this is the dementia.
Okay. Yeah. And how are the stats here in Indonesia for Alzheimer?
Alzheimer in Indonesia in 2015, 1.3 million.
Wow.
Yeah.
Comparing to 2 years ago.
Yeah.
So it had risen more.
In 2030, it's more doubling.
Okay.
Yeah. In 2050, around 4 million.
Wow. Yeah. And basically, how is it common worldwide with Alzheimer? Is it common?
Yeah, it's common in worldwide.
Okay.
Yeah.
And for example, for those who aren't aware of the symptoms, what are the symptoms for Alzheimer?
The symptoms is the first symptoms, maybe like your father asking for the same question
every 5 or 10 minutes.
Because the recent memory, the first one, the recent memory is lost, and then after that, after memory, language, they cannot. If they want to speak or ask something, they don't know what I have to do. I have to talk. Or they don't know what is this. This
really?
is
So it's really that bad.
Glasses. Maybe they want to talk. This is glasses, but what is this? I don't know.
So they forget things.
Yeah, they forget. And for the severe dementia, maybe they forget the child, the husband, the wife.
Really? Yes. Is that in the worst case?
Yeah.
Has there been any other cases that you've went through for people that has Alzheimer? Any, unique stories?
Yeah. Yesterday I have a patient. When she wake up in the night and she saw her husband and she
push him
because you are unpolite. You sleep with me. I am a married woman, because she forgot her husband.
And how long is that process? That she realized that, hey, that's my husband?
No. Until now, she don't realize she is her husband. Yeah.
Okay. The question.
Until her husband.
Look at the photos.
Look the photo where.
Does she still realize it when you do that?
No. This is a handsome man. You are old. You are not my husband.
Oh, so basically she doesn't remember. Like, for example, this is not you because the photo from your photo album is different. This is not you, as if she's telling a lie.
Yeah.
So my question is this: it's very unique. Also, can we cure it?
Yeah, unfortunately, we cannot cure it until now.
Okay.
Yeah, and that's why we have to prevent.
Okay. How do we do that? By preventing when we have?
Yeah, you have to keep active.
Okay. Active as in we have exercise, we go out, or what do we do?
Keep active and be happy. That's the point, I think.
Okay.
Yeah, it means you have to do something
that you like.
When you, for example, after my dad retired, maybe he still do something.
He wants to be active.
Yeah, he must be active.
Right.
Yeah, don't stay at home. Don't do anything that makes him more depressed.
Really?
I'm not
being used again, or I'm retirement. No one wants me to work again. So basically, you have to be active in that.
Do something what you can do.
Okay. But do we have to go to doctors for checkups every now and then, or?
Yeah, you can do to doctor. You can go to the GP. You can do screening.
Okay.
Because before you get the diagnosed dementia.
Yes.
You get mild cognitive impairment.
Okay, what is that?
It means you can do everything. You can take care of yourself.
Right.
But if you do the screening, we know that you got mild cognitive impairment.
Okay, so basically they can trace you that you have a mild cognitive Alzheimer. Okay. And talking about age, for example, is there any age that we have to be careful? Like, for example, my dad is 64, is that the age of start of Alzheimer, or you can get an early stage?
Yeah, Alzheimer disease is not part of aging process.
It's not?
Yeah, it's not part of aging process. But if your dad diagnosed by Alzheimer, it's genetic factor.
It's genetic?
Yeah, it's genetic factor that you must be careful.
So it might go down to me also?
Yeah.
Okay. For example, what are the risks of people to get Alzheimer? What are the people like that? Like, for example, is it the...
But if you have the risk factor younger, maybe at 40 years old, you have diabetes.
Okay, so basically like what you said before, if you have diabetes at an early stage, you can get an Alzheimer at early age. Okay. And how important is to having early diagnosis?
Yeah, if you got the diagnosed earlier than when you come to the doctor in severe states, we can make the longer states in early states until the middle or severe states.
Okay. And basically, and also, when is the best time? For example, when you know you forget things, or when it's time to seek the doctor, for example, is it signs like, for example?
Sometimes we forgot something.
Right.
Yeah. Sometimes when we maybe for example, from my room I go to the refrigerator. After I open it, what I want to
you
do
forget
here.
What you want,
I forgot. Yeah. But if I can recall it, 1 hour, 2 hour, 1 day, 2 day, 1 week, it's a normal. It's normal.
Okay.
It's not a part of dementia.
Okay.
But if you try to recall and trying, but you cannot recall it, you have to go to the doctor.
Because at times, like, for example, when it comes to, I forgot what's this. At my age right now, and then I'm worried that, is this an early stage of getting Alzheimer or not? Or maybe I was tired, or maybe I'm stressing out.
Yeah, maybe you are tired, you are not enough concentration.
Probably I don't have enough oxygen in my head. Okay, that's not an Alzheimer, that's good. And I want to ask you basically, is there any certain foods we have to avoid of getting Alzheimer? Is there any food? Because we seem that as we're still young, we can eat whatever we want. We eat junk food and everything.
Junk food.
Yeah,
you have to.
Oh my God!
Don't eat junk food because it's junk food can trigger the diabetes.
Junk food means like gorengan or burgers and everything?
Burger.
Oh my goodness, you just said burgers, huh?
Hypertension triggered by the junk food.
Really?
Yeah.
But for example, if we do, I'm not trying to deny, for example, if we do eat burgers and we exercise, can we Is it okay? I mean, come on, who doesn't love burgers and gorengan? We all love that, right?
If you do exercise and you eat a good food, that's good life, I think.
Right.
Yeah. If you want to eat burger once a week or once a month, it's okay.
Okay. So once in a while, it's okay, right? It's not like you can go and you have to be a vegan or anything, right?
Yeah.
Okay, that's good. I just want to make that clear because I love burgers. All right. And talking about the cure, how are we far from finding the cure?
The cure?
Yeah. Finding the solutions, for example. Can we cure Alzheimer?
No. We cannot cure Alzheimer, but we can prevent.
Prevent?
Yeah. Like my...
Your dad?
No. My peneliti, my experiment. I do experiment in poco-poco to do poco-poco dancing.
Really?
Yeah.
So basically you can prevent by dancing poco-poco?
Yeah, by dancing poco-poco.
How is that? Could you tell us a bit about it?
Yeah, because I do it to my respondent. My respondent is people with diabetes.
Okay.
And who have mild cognitive impairment.
Okay.
And I give intervention poco-poco 2 times a week, 30 times for 3 months.
Okay.
And the result is very, very good because I see from the magnetic resonance imaging spectroscopy and the neuron, the people with diabetes and mild cognitive impairment, the neuron more active in prefrontal cortex, hippocampus, and parietal.
Wow, I just couldn't understand what you're trying to say, but that seems very interesting. It's very interesting. But yeah, so basically this is one of the ways that you can prevent of having Alzheimer. Okay, doctor, thank you very much.
Thank you.
Hopefully we'll see you soon. And don't go anywhere, because after the break we will discuss how one community is using dance to help Alzheimer patients. Stay with us on Daybreak.